Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is August 4, 2025. This video is on two articles in Nature Medicine, one titled Systematic Review and Meta-Analysis of IV iron therapy for patients with heart failure and iron deficiency. And another is a research briefing published on 1st August 2025 titled IV iron therapy reduces cardiovascular events in heart failure. And this briefing is on the first article mentioned. Iron deficiency is common in heart failure and linked to worse symptoms, reduced quality of life, higher hospitalization rates, and mortality. These investigators conducted a meta-analysis. They included 6 randomized controlled trials: FAIR heart failure, confirmed heart failure, affirm acute heart failure, Ironman heart FID, and FAIR heart failure 2, with 7,175 patients. 3,672 received IV iron and 3,503 were controls. The median follow-up 6 to 32 months. Mean age 67 to 74 years. 64% were male. 50% were anemic. 40 to 83% had a transfusion saturation less than 20%. The primary endpoint was recurrent heart failure hospitalizations and cardiovascular mortality at 12 months and total follow-up. They used Bayesian and frequentist NAP heart-lung randomized effects meta-analysis using patient-level data of the 5 trials. What did they find? IV iron reduced composite heart failure hospitalizations plus cardiovascular mortality at 12 months, relative risk 0.72, Bayesian posterior tail probability 0.007. The benefits were consistent over the follow-up period, relative risk 0.81. The effect was the strongest in 1 year. There was no significant reduction in all-cause mortality. The benefit was seen in men more than in women. Transfusion saturation, less than 20% had worse prognosis but similar relative benefit. Safety, no excess risk of infections or serious adverse events with IV iron. The key takeaway, IV iron reduces heart failure hospitalizations and is safe in HFrEF patients with iron deficiency. Further research is needed in gender differences and optimal dosing. The accompanying research briefing to summarize the key insights. IV iron reduces risk of heart failure hospitalizations and cardiovascular death by 28% at 12 months and 19% over total follow-up period. Meta-analysis of 6 randomized controlled trials in patients with heart failure with HFrEF and iron deficiency was used using harmonized analysis methods. Benefits most evident in the first year, correlating with higher iron doses. Safe profile confirmed with no increase in serious adverse events with IV iron. Gender-specific differences were observed. Women did not experience event reduction, prompting further research. Implication: supports IV iron use for both symptomatic and outcome improvement in HFrEF with iron deficiency. History of iron deficiency. The Egyptians and the Greeks used iron tonics for weak blood. Hippocrates is supposed to have said it's important to eat iron-enriched earth. In 1025 CE, Avicenna described anemia-like symptoms in the Canon of Medicine. In 1832, Pierre Blot created the Blot pills, the first oral iron supplement. In 1940s, iron was linked to hemoglobin synthesis. Anemia was studied post-World War II. 1970s to 90s, WHO targets iron deficiency as a major global health issue. 2000 to 2020, it was recognized as a systemic disorder beyond anemia. IV iron trials in heart failure were conducted in this period. Today, iron deficiency is understood as a metabolic, mitochondrial, and inflammatory condition. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.